Australia is an amazing experience, and so many people who go there have the same reaction. We've traveled 23 hours. We've flown across just about every time zone, and we're rather close to Antarctica, and yet it's so familiar. When we discovered that Australia had a 5 times better rate, 1/5 the number of maternal deaths, and also we were aware it had a very interesting health system, we decided that it was beyond good coincidence that there was an International Women's Forum conference there, and that we could actually combine a study tour of Australia and maternal health services with a vibrant conference of women from around the world. The thing about Australia was this enthusiastic exchange. So they wanted to hear from us, but of course we wanted to hear from them. And there was a lot of warmth and camaraderie in every meeting we went to. Of course, everyone has their favorite moments on the trip. And the one problem is some of us had so many favorite moments, but the state system in Australia is very strong. So if you've seen one state, you've seen one state. They're all very clear about that. So visiting Melbourne, which is in Victoria, is very different than visiting New South Wales with Sydney and Newcastle. Able to understand the system, I like to say, from the top down and from the bottom up. So every day we had an interesting mix of hospital-based care, community-based care, and then also we looked at it from the role, workforce roles that are not customary in the United States, in particular midwives, and let me say midwives and more midwives. Still processing this dazzling exposure we had to interesting people, to state-of-the-art programming, and to what it takes to have a maternal mortality rate that is 1/5 of ours. We included Tasmania, one, because although we had to take a plane, but in Australia that's kind of a given when you travel about. But also, and so it made sense if you're going from Sydney to Melbourne to take a stop in Tasmania. But we were intrigued. Tasmania has a fascinating history. It's got kind of a culture of its own. So it was quite a royal reception, and we got to meet a number of the women that we would then spend a lot more time with in Melbourne, but it was a great prelude. The one thing nice about being in Melbourne, the city is actually different. They're both large cities. They both have large populations. They're both very expensive. So there were some similarities. There were some differences. Both had extraordinary women's hospitals. I would say you can't beat the one in Melbourne. It is absolutely indescribable in so many ways. And so respectful of women. It was a celebration of women. We met maybe one of our favorite hospital administrators ever, Sue Matthews, and her chief midwife, Tanya, who was a force. After just a kaleidoscope of amazing experiences and meeting interesting people, then we went to the IWF conference. We met women from all over the world, and I never met an uninteresting person. These women are breaking ground everywhere. They're shattering glass ceilings. And the speakers, every speaker, was so articulate and spunky, but also progressive and change-oriented. I would say to everyone, travel, but I know, for me at least, travel that has a purpose, a mission, an educational focus. A visit just seeing the sights is something that pales in comparison to the experience we had in Australia, where everything, our brains, the visual beauty, the things we learned, the history of the country, the people we met, all of this came together in a way that without any one of those components, we would have missed something big.